I'm Jonathan Golding. I'm a diabetes and endocrine registrar. I'm researching type 1 diabetes in older adults.
I'm Daisy Woolham. I'm an infectious diseases and microbiology registrar. I have got one of the Research Accelerator Awards.
My name is Stephen Robinson. I'm a clinical oncology registrar, and my project is trying to develop a blood test as a liquid biopsy biomarker for brain tumours.
My name's Todd Leckie. I'm an anaesthetics and intensive care specialty trainee. I've recently undertaken an MD, which was funded by University Hospital Sussex, and that was exploring how we can better support patients who are preparing and then recovering from surgery.
There are so many benefits to being a doctor, being a clinician, but to kind of enact larger change and kind of drive forwards how we manage people and patients on a kind of a larger level, we need to be getting involved in research. We need to be understanding the conditions and working out how best to manage them.
I started to think about how research could affect the patients I was seeing in my work as an anaesthetist and an intensive care doctor, particularly how we could better support patients around the time of surgery.
Brighton has a high population of drug and alcohol users and a much higher rate of drug deaths than other parts of the country, including the southeast. And when I started exploring what the evidence base was around things that could be done to improve that, I found there was actually quite a lack of research in that area, really trying to centre the patient voice and the patient experience in everything that we do.
I kind of realised that there were some people with type 1 diabetes who were getting older, but perhaps the services weren't there to meet their needs, and it seemed unjust. So I wanted to investigate it a bit further.
I think coming from a really fast-paced NHS environment, which is where I've always worked, I've always been a clinician, to kind of the more self-directed sitting and reading papers and thinking is quite different. And I think it's definitely been a bit of an imposter syndrome in the last few weeks. But yeah, starting to feel more confident and feel like I have a clear idea of what I'm doing with my time.
I've learnt things that I think are new to the field. Certainly some of the results were not at all what I was expecting.
It's a great opportunity. It's not easy, but what it allows you to do is really spend more time getting to know and understand your patients and what their needs are.
The variety in your day-to-day is just so rewarding.
It's a brilliant opportunity. A time to research a topic in greater depth is amazing. You learn a lot about yourself, you learn a lot about the subject that you're learning about, and I would highly recommend it to anyone.